Hi guys, coronavirus is everywhere and you cannot escape it. And in this video, I'm gonna answer the most important question: how deadly is the virus? If you Google it, 3.4% is the estimate from World Health Organization, which is extremely high. If you go on Wikipedia, you will get pretty much the same result. Let's do our own calculation and see why it's wrong. Let's compare the data for China, Italy and South Korea. These are three countries which had epidemic for a very long time and it's been pretty well studied. If we go to Wikipedia, we can easily check how many people died compared to how many people got sick. For China, it's 4%. For South Korea, it's 1.1%. And for Italy, it's crazy 9.2%. You might ask yourself why this is so different. And one of the common explanation is that China got this virus completely unexpectedly and people were unprepared, they were overwhelmed, and that's why they end up with 4%. And in South Korea, in contrary, they were well prepared, very good health system, and they managed to reach 1.1%. This is very strange but quite popular logic among many people. So let's see why it's actually wrong. As you probably heard, coronavirus death rate is different if you're 80 plus or you're under 50. And if you Google what is the death rate between different age group, you will most likely see this chart. Basically, if you're 80 plus, your death rate is 15%, which is super high. If you're from 70 to 80, it's 8%. Well, not so bad. But then if you're under 50, your death rate is probably only 0.3%, which is very good news, obviously. But the thing is, like, what if in South Korea all the patients were young and, for example, in Italy all the patients are old? Let's check it out. I've made a plot for percentage distribution by age for Korea and Italy. As you can see, in South Korea, it's pretty clear that 30% of infected are guys from 20 to 29. And at the same time, you can see that in Italy, most of the cases are happening within 60 plus group, with almost 20% 80 plus group. Problem solved. Korea basically got very lucky statistically and they got lots of young people, and Italy got very bad statistically and got lots of old people. And China probably got everyone, and that's why they have 4% death rate. The problem here, it's pretty hard to find an age distribution data for China. The only thing which I've found is this article from China CDC. The problem is that these are intermediate data when they had only 40K of the cases, not 80K as they have it right now. And the death rate here is actually 2.3%. And look, all the death rates by age matches exactly to what we've seen before. Pretty much the most common fatality rate by age chart was made out of outdated Chinese data. This is not right. Let's look at the same death rate chart for Italy and South Korea. For every age segment, Italy is 2-3 times more deadlier than South Korea. This is very suspicious. To solve this mystery, you need to understand how people are being tested in Italy. So if you display some symptoms of coronavirus, you're gonna get tested. And if you got positive, then maybe all your household will get tested, but you will never go too far. In Korea, they try to test as much as possible all the social contacts. And that's how they actually contain the virus. And if you look at all the statistics, Korea has the highest number of tests in the world overall and highest number of tests per capita. What does that mean? There are way more sick people in Italy which have never been tested and we never been discovered them. If you look at this difference between death ratio between these two countries, you can clearly see that probably in Italy you have 3 times X. Now it's 15 something K, so in reality probably there are 150 people with COVID in Italy. From one side, it's really bad that you have 3x more people than actually reported. But from the other side, the deadly rate of this virus is much less. To give you another proof of my statement, you can just look at how many positive cases are per test. If you look by region, Lombardy, which has the highest death rate, 12.7%, has almost 40% positive cases per test, which is crazy. If you look at some other countries like Korea, it's usually just 5%. What does it mean? They don't have enough tests and they test only those people who really had some harsh symptoms. What about China? Do they have the same problem as Italy? Apparently yes. They didn't test many people, especially at the beginning of epidemics. So there could have been many cases which were asymptomatic or which had some symptoms but they were too light and people just get cured eventually. And there is a very interesting scientific article which was just released a couple of days ago. Basically, they claimed that the actual fatality rate in Wuhan from all people who displayed COVID symptoms were 1.4% instead of 4.5%, which you use the crude statistics. How did they do this estimation? They basically check all the data available on how many infected people were on different charter flights, regular flights from Wuhan during different time of epidemic. And then they apply a pretty complex mathematical model to make the simulation. And that's what they got. To summarize, the death rate from World Health Organization is grossly overestimated. And instead, we should use South Korea data. If you're 80 plus, your death rate is 10%, not 15%. If you're 70 to 79, your death rate is 5%, not 8%. If you're 60-69, your death rate is 1.5%, not 3.6%. The most important is that if you're under 50, your death rate is only 0.1%, which is really, really low. And these data are pessimistic because in Korea they haven't tested all the people, so there could have been some asymptomatic folks which had this disease and we don't know about them. So guys, please don't panic if you see some crazy death rate number for your country, because it might be just that they don't test enough people, and that's actually the case for many countries right now, especially in Europe. Thanks for watching. Don't forget to like and subscribe to my channel. I'm gonna update you on COVID, hopefully more interesting videos. Bye.